Welcome back, everybody. Well, tomorrow is June 9th, and that means it's time for our segment, KEZI 9 Checks In.
Yeah, it's a monthly reminder of the 9th of the month for women to do a self-breast exam to check for any lumps or changes. And this month, we're also focusing on traveling for women who are pregnant. Here's KEZI 9 News anchor Renee McCullough.
Joining me now is Dr. Christy Kalel with Women's Care. And now that it's summer, we're talking about travel and pregnancy. So the first question, is it safe to fly when you're pregnant?
Luckily, it is. According to the American Academy of Pediatrics and the American College of OB/GYN, we do think it is safe to travel up to 36 weeks. Now, of course, you should talk to your physician. There are some conditions that might not be suitable for traveling, so you should really make sure that you are someone that is eligible for travel during your pregnancy.
All right. Is there anything special that you should do before you travel?
You know, the biggest things are going to be where are you going and how long is your flight. So if you are traveling overseas, for instance, you should probably check the CDC website. Make sure that there's not some endemic disease. I mean, Zika is a big thing that's been going on a lot, and it's spreading, and so you should make sure you're not going to a region that is endemic with that. The other thing to think about is, are you going someplace that you're gonna have access to care? You know, are you at risk of preterm labor, which in that case you probably shouldn't be traveling. But are there, you know, adequate medical facilities if anything were to happen, someplace you could get checked out? And those are the two big things you should really be considering when you're traveling.
How about a road trip? What should people know before they hit the road?
So outside of just generally driving safe, it's important to increase your mobility. So about every hour or so you should get out, walk around. I usually tell most of my patients, make sure you're always wearing a seatbelt. Your seatbelt should be low and across your hips. You also want to wear the top strap in between your breasts kind of loosely, so just make sure you're wearing that appropriately. I would also get compression stockings, those can help.
Any tips for women to stay generally healthy when you're traveling?
No, not outside of just diet and exercise and what you normally do to stay healthy in pregnancy.
Okay, and then what would keep women from traveling while they're pregnant?
A multitude of conditions. Again, that's a great question. That's individualized. Every patient should talk about that with their physician. I mean, there's certain cardiovascular disease, increased risk of stroke at baseline, or any kind of clotting disorder. And then again, someone who's at risk for preterm labor. Those are just a few that you probably wouldn't want to travel, but again, you should talk to your doctor.
Perfect. Thank you so much for joining us today. And for more information, you can go to our website at KEZI.com, and we'll have a link to the Women's Care site.
All right, Renee, thanks. Well, remember, be sure to go to our website to sign up for KEZI 9 Checks In, and we'll send you a reminder each month to do your monthly self-breast exam.